Hello, welcome to our series of tutorials on basic surgical skills. My name is Agastya Patel. I'm a final year medical student here at the Medical University of Gdansk, and we have created these videos along with our colleagues from the resource team and International Relations Office. These videos will review several suturing techniques and surgical knot tying. We hope that these videos will complement your surgical education here, and practicing your skills is of utmost importance. But before we get to that, we'll look at some tools that you'll require to practice your basics. Alright, to make your way through these tutorials, you'll need 7 things. Some kind of gloves, here we have surgical or sterile gloves, something to suture on, a scalpel, needle holder, suture material, toothed forceps, and scissors. Each of these serve a purpose. Now let's look at them a little more closely so that these tutorials are easy for you to go through. So the first thing you'll need are gloves. We have a video on how to put on sterile gloves, so you should check them out, but you can also use normal or non-sterile ones. Next is the thing which you'll practice on. We will be using a pig's feet for these tutorials, but there are a few other options which you can choose to use, like this pipe insulation foam, which is used at our university here sometimes, or you can buy these practice pads which have skin layers and are really great to use as well. Then is the scalpel, and of course this is used to make the incisions. So we'll take it out of the package, and you will notice that it has a shaft. Here it has a plastic shaft, which means it's reusable, and to the shaft is attached the blade through the mechanism here, so we can replace it and put on a new one. But how do you hold a scalpel? So here's how you do it. The shaft between your fingers and your index finger on the top of the scalpel, which is going to help you apply the pressure to cut through the skin. So I've already made an incision here, but we'll take a look at how it's done. So you want to go and make a straight cut down the area, but you do not want to make repeated incisions like this. And if you want to make a more precise cut, you can hold it also like a pen and then make a more controlled incision. Right. So once you're done with using your scalpel, always remember to put it away safely so you do not hurt yourself or anyone around you. Then you have a needle holder. So as you can see, there are a few important aspects of this thing. You have the rings, which will help you hold and unlock and lock the second important thing, which is the lock-in mechanism. And one thing I'd like you to notice is that they have some teeth here, and this is going to help you keep the needle in place. So first, let's see how to hold a needle holder. What is usually recommended is that you use your thumb and your ring finger and have these 2 fingers down here to support your needle holder, right? And what I want you to do is try this. Put your index finger and thumb finger and try rotating your wrist. And you'll see that it's a bit uncomfortable. Then go down to the next finger. You'll see that your range of motion improves. Go down to the ring finger, you'll like it better. And you could try your little finger if you like, but then you have too much going on in the front and this also becomes a bit uncomfortable. Another important tip is to always wear it at the very tips of your finger and not wear something like a ring, because this is going to make it really uncomfortable for you to open, close it, and move your wrist. Okay, so now let's see how the lock-in mechanism works. To unlock it, what you need to do is push with your thumb, push up, and pull down with your ring finger. So something like this, and it's going to snap out, right? Just push with your thumb, pull down with your ring finger, and that's going to open it. And when you want to close it, you just simply bring the two fingers together, and it's going to go through the steps and snap back inside, right? So that's your needle holder. Then you have your suture. So as we can see, this is a nylon 3/0 suture with a reverse cutting needle. So let's open the pack. And it comes inside this container. We can tear it open. You can use your needle holder to bring the packet out. And once you have this packet out, you open it and you'll see the needle inside. And you generally want to avoid using your fingers to grab the needle, but sometimes it does happen. But try to avoid it, okay guys? And then you just pull your thread out. Now comes into play the forceps. One of the things the forceps is used for is to reposition or refeed your needle back on your needle holder. So you're gonna grab it and try to reposition it in the correct manner, like this. You see, do you hear the lock-in? Once you put your needle on the holder, you have to lock it so it's going to stay in place. When you go through the skin, it's not going to move. The next thing I'd like to tell you is, once you have done the locking, you can actually palm your needle holder. This is called palming, where none of your fingers are in the ring. And this is just going to make your range of motion much better. Let's also take a look at how to hold your needle with the needle holder. Ideally, you'd like to hold it at about 1/3 of a distance away from the thread end of the needle and with the very edge of the needle holder. What you don't want to do is hold it at the very end of the needle, because then when you try to pierce the skin and apply that pressure, your needle might bend or it might slip out. And you also don't want to hold the tip of the needle, the sharp end, with the holder, because this might make your needle less sharp, it might make it blunt, and then you won't be able to pierce the skin. So that's your needle and your suture and your needle holder. The next thing that your forceps is useful for is to grab your skin and to lift it up so you can see what layer you're going through, right? So one is to refeed your needle back on the holder, and the second is just to flip the skin so you see what you're doing. And how to hold it is just like a pen, so nothing complicated there. And lastly, you have your scissors, and they're basically used for cutting off the excess thread once you're done with your suture. So those are all the things that you're going to need. So in this video, we'll show you how to put on surgical gloves or sterile gloves. These, as you can see, are size 7. Right. Inside you have the packet, which is sterile. The outer one you can touch with your hands. So let's open, and you drop it on your surgical sterile field. Before you touch the sterile field, of course, you need to wash your hands. After washing your hands, now we can touch this inner packet and open it. You only want to touch the edges or the corners of this packet so that you don't unsterilize anything by mistake. You may notice that there are these images indicating left and right hands, so make sure that you have the packet in the right position and not the other way around. Grab these corners and slowly open up the packet, making sure that you don't touch anything on the inside. Again, you will see that you have an R written on the glove, which means that it's for your right hand, and an L written on the other glove, that's for your left hand. Notice that the gloves are folded in a certain way such that you have an inner surface which is going to touch your skin, and you have an outer surface which needs to be sterile, so do not touch that with your bare hands. First, you should put gloves on your dominant hand. For me, it's the right hand. Lift it up, touching the inner surface like this. Tuck your thumb into your palm and slide it into the glove, making sure that you put your fingers through the correct pockets. Wiggle them through so that you put them on properly. Always make sure that your bare hands are touching only the inner surface and not the outer surface of the gloves. Now that your dominant hand is sterilized, you can use it to wear the glove on the other hand. This time you should grab the glove from the outer surface. So how you want to do this is first introduce your dominant gloved hand in this folded space like this and lift up the glove from the package. Wiggle your hands in. Make sure that you don't touch the inner surface of the glove with your sterilized hand. Then open the packet through which your hand's going to go through and wiggle your fingers into the glove, pushing it up with your right hand. And of course, if you don't manage to put all the fingers in properly, once you've gloved your both hands, you can fix them later on as such. And then remember to fix up your sleeves. Don't touch your hands or the inner surface because it's unsterile now. And there you have it. That's how you put on sterile or surgical gloves.